Neurodevelopmental disorders in children, understanding ADHD and tic disorders. ADHD, attention deficit/hyperactivity disorder, and tic disorders are common neurodevelopmental disorders seen in children. ADHD, attention deficit/hyperactivity disorder, and tic disorders are common neurodevelopmental disorders seen in children. ADHD is diagnosed in children below 12 years of age, and it is more prevalent in boys. There are three types of ADHD: predominantly hyperactive-impulsive, predominantly inattentive, and combined type. Tic disorders are brief, rapid, and recurrent motor or vocal movements performed in response to internal urges. ADHD, attention deficit/hyperactivity disorder, and tic disorders are common neurodevelopmental disorders seen in children. ADHD, attention deficit/hyperactivity disorder, and tic disorders are common neurodevelopmental disorders seen in children. Treatment of these disorders includes behavioral therapy, pharmacotherapy, and psychiatric consultation. Methylphenidate is the drug of choice for ADHD, while Clonidine and Guanfacine are first-line drugs for Tourette's disorder. It is important to note that the symptoms of these disorders usually go away during teenage, and proper medical care by a psychiatrist can help manage the symptoms effectively. Children with ADHD are also vulnerable to substance use disorders, antisocial personality disorder, and mood disorders like depression, making it crucial to seek early treatment. In conclusion, early diagnosis and treatment of ADHD and tic disorders can help improve the quality of life for children and prevent the development of secondary disorders. Psychology. More in detail. Nowadays, many children are facing problems with motivation, attentiveness. Some movements may be verbal or motor. This is some research on the topic. According to latest guidelines of ICD-11, International Classification of Diseases 11th revision, it is considered neurodevelopmental disorder. It is neuropsychiatric disorder. More common in boys. Earlier it was known as minimal brain dysfunction. Clinical features of ADHD. Inattention. Child unable to keep attention on single activity. He will keep changing his work. He will not have focus like his friends. Hyperactivity. Roaming in class disturbs other students. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, we can give diagnosis of ADHD in children below 12 years of age. There are some soft neurological signs which we can see in ADHD child, like unable to draw figures according to age and unable to differentiate between right and left. Types of ADHD. 1. Predominantly hyperactive impulsive, symptoms of hyperactivity and inattentiveness seen. 2. Predominantly inattentive, symptoms of inattentively is seen. 3. Combined, symptoms of both inattentively and hyperactivity is seen. Treatment. Symptoms go away at puberty in 50% cases, and some may need psychiatric consultation, behavioral therapy. Some children are vulnerable to O. Substance use disorders, alcoholism. O. Antisocial personality disorder. O. Mood disorders like depression. Tic disorders. Tics are brief, rapid, recurrent motor movements, motor tics, or vocalizations, vocal tics. Performed in response to internal urges. Simple. O. Blinking. O. Shoulder shrugging. Complex types. O. Jumping. Echolalia, repeating of other speech. Coprolalia, use of obscene words. Coprapraxia, making obscene gestures. Tourette's disorder or Tourette syndrome. Child must have multiple motor tics $#, that is what it means $#. 2 or more than 2 motor tics. And 1 or more vocal tics. Motor tics, abnormal head movements, blinking of eyes, jerking shoulders. Verbal tics, coughing, throat clearing, grunting, sniffing. Symptoms onset at age of 4 to 6 years of age and symptoms are at peak at age of 10 to 12 years. O pharmacotherapy treatment. Clonidine and Guanfacine, first line. Risperidone. Haloperidol, Pimizide, FDA approved. These all disorders can be treated easily by the help of a psychiatrist and proper medical care. Maximum symptoms go away at teenage.